To continue our program, and as I indicated earlier this morning, we have a schedule change. Michael Onestis, who was supposed to speak at 11:45, will be speaking at 1 o'clock after your buffet lunch. But we are honored to have Congresswoman Debbie Dingell with us this morning and afternoon to share some remarks, and I'd like to have Rich Homberg come up to introduce the Congresswoman. Rich?
Hi there, good morning. I want you to listen for something in our speaker. It's what you might call the Dingell moment. Congressman Debbie Dingell, I've seen her speak 100 times, I think, and obviously the late Congressman John Dingell as well. In every conversation I've ever seen the Congresswoman involved with, at some point she pivots off of politics and government and funding and issues, and she says, let's talk about real people. And if you think about this conference, a Congresswoman who always drives the conversation back, how does this really work with people? How will it affect this group of people or that, or how will parents access this? How can we bring together people? Never forgotten. The policy stuff, always there. Knows Washington as well as anybody you'd ever want to talk to. But listen for the Dingell moment, because I'm sure it will occur. I've never seen it not occur. So I'm humbled to be in front of you. It's an honor to introduce one of the champions of and one of the smartest, sanest voices in Washington, D.C., Representative Debbie Dingell from the 12th District of Michigan. Debbie is right at home with the likes of you. She's committed to helping her constituency and the country as anybody I know. She carries on the great tradition of her late husband, John Dingell. Among his many accomplishments, as you know, he was a tireless fighter for universal health care and the passage of the Affordable Care Act. And Debbie has been just as persistent and effective in protecting the rights of people to affordable, accessible health care, including coverage of mental health treatment. Before being elected to Congress, Debbie worked for General Motors, where she was the head of their foundation. She's been particularly active in causes related to the well-being of women and children. She successfully fought to have women included in federally funded research and advocates for greater awareness of issues directly related to women's health. She's a founder and past chair of the National Women's Health Resource Center and the Children's Inn at the National Institutes of Health, and has served on boards of many organizations on many issues important to women and families. Debbie's just as passionate about initiatives that are related to young people and education as chair of the Wayne State Board of Governors and co-chair of the Children's Leadership Council, a business-led advocacy group that promotes investment in early childhood. She has chaired the Infant Mortality Task Force and the Baby Your Baby public education campaign that reduced infant mortality rates. I could go on, you know her well. One of the other things I admire about Debbie is her ability to harness the power of government, labor, business, and community organizations to bring about positive change. I can't think of a more important person to put in front of you today. The engine, and we'll watch for that Dingell moment. Congresswoman, welcome.
Good morning, almost afternoon, on a rainy, yucky day. But aren't you glad it's not snow? I want to thank Rich for that wonderful introduction. Now he's got me, like paranoid about, I will have a Dingell moment, I'm going to admit it. But I don't think of it that way. I want to say, first of all, that it's really good to be with all of you today. I wish we didn't have to be together today to talk about this difficult issue. But it's good that people are willing to come and talk about it, because for too long, people weren't even willing to come into a room and talk about it. And I'm going to talk about that more in a minute. But I thank you for even being here and caring. I really want to thank Gail and John Urso, who I just really met or talked to, but they have taken something horrible and made it into something that's making a difference. And we all would not be here if they had not started Heaven's Song. So thank you. And it's because of their work One of the things that we've got to start being able to do is to have real conversations surrounding suicide and mental health. And it's one of the reasons we talk about coming out of the darkness when we do the suicide walks, because people wouldn't talk about it. They still don't want to talk about it. And quite frankly, this subject for too many people is taboo, and we've got to get them over that and really talk about people have issues. People get depressed. And if it's okay to get the flu or the coronavirus, or why is it not okay to talk about being depressed? Because if we did, we'd be able to help a lot of people. This conference is important. By bringing together the educators, the parents, the students, the mental health professionals, crisis center workers, the first responders, policymakers, that matters, survivors, employers, veterans, and veteran support groups, and just people who've been touched by it, you recognize that suicide and mental illness affect everyone. We can all work together to create safer and supportive schools, workplaces, and communities. And by coming together to share best practices, the latest research, and specific preventative and evidence-based practices, we can have the greatest measurable impact on saving lives. So I thank everybody who's here and the organizers for letting us have some honest talks. Sadly, for many of us who are here, who have and remember those we've lost to suicide, we are the ones that are saying we can't sweep this mental health issue under the rug anymore. It's an issue that needs to be addressed in all facets of our society, but it just gets not done or overlooked because we're afraid to have the conversations. The issue is personal to me, and I had a sister, Mary Grace, who I loved. She was my baby sister. She started having issues, who knows when, they were young. And there wasn't anything, I will tell you quite frankly, we're talking about when we have this discussion, and I'll talk more about it in a minute, there are all kinds of people that, we have young people that are in school that are being bullied that we need to stand up for. We have veterans where 22 veterans are committing suicide every day. The fourth leading cause of death in the 25 to 55, I think, is suicide. So people I had a younger sister who was probably bipolar. People didn't talk about those diseases when she was that age. And I think that a lot of people treat themselves with drugs or alcohol because they self-medicate. They're anxious or they're depressed and they can't afford it. A lot of people can't afford it. And those that can don't want to admit that they have the problem. They're afraid that they're going to be stigmatized. So my sister started using drugs. She may have started as early as grade school. And for 25 years, I was on an odyssey of trying to help her, I knew she was suicidal. I knew she was a threat to herself. There is nothing that I didn't experience in those 25 years. The desperation of trying to get somebody help that needed it in a system that doesn't let you help an adult, even if they are suicidal, because they say they're not. So you can't get them health care when they need it because you can't get them to involuntarily go into the hospital. She would disappear. I wouldn't know where she was. I went to morgues looking to see if she was there. And ultimately, she did die. And I was stunned at the time, and the amount of drugs in her body, the doctor said it had to have been a suicide. My mother, and I shouldn't say this, so I try to be careful because this isn't just my story. My mother's still alive. And my mother to this day doesn't want to acknowledge that it was a suicide. And that's part of the problem that we are dealing with. I had a family relative who was diagnosed with a mental health illness, and rather than deal with it or get treatment, went to a gun store, learned how to use the gun, went home, and shot and killed herself in the bathtub of her parents' home. So I know the realness of this just in my own family. And I was talking to a number of the people that were involved in this. We have a real, one, we don't want to talk about it. There's a real stigma. And the reason that I do talk about it, and it not only is my sister who died by suicide, but I myself grew up in a home with someone who had issues. And I remember what it was like to live there. But we don't have mental health providers in this country. There is a real shortage. So I was, in a period of 1 week, several things happened. It's probably been 2 years now. But many of you will remember at Central Michigan University, there was a young student that shot and killed his parents. Many don't know the backstory, that on that Thursday night, he knew he needed help. He was in serious trouble. He went and asked officials at Central for help. They took him to the hospital. There was not a mental health provider available or a bed available. So they called his parents to come and get him, which they did. And when his father was in the room, he grabbed his father's gun and shot and killed his parents. He knew he needed help, and there wasn't anybody there to help him. And that very same weekend, I was in Ypsilanti, and I'd gone to a fundraiser for a school teacher there who had died, but I was talking to a couple. He was the wrestling coach. She was the school teacher. Their daughter's an opioid drug addict. They've got custody of the 2 children, 5 and a 7-year-old. The 7-year-old was already drawing pictures with knives and people and blood drops, and they wanted to get him help, and he couldn't get an appointment at the University of Michigan for 8 months. And I was trying to find out delicately, was it a money problem? It was not a money problem. I called the University of Michigan. And there is that kind of wait, and it may be longer for all I know now, for somebody to get in to see a pediatric psychiatrist, and it's almost as bad for someone that is older. And then I actually was then speaking to a pediatric group on healthcare, a pediatric healthcare group, right after that happened. And they told me that that was one of the most significant problems that they had in pediatric healthcare, is the shortage of doctors. So I immediately headed to University of Michigan's emergency room because I wanted to know more. And if you go into, and I went to St. Joe's, and I actually went to Henry Ford's. If I get a bugaboo about an issue, I want to understand it. And all of them have problems. You know, people come in and they need help. They're keeping them in emergency rooms for hours and days because they don't have beds. Someone can be suicidal, and we don't have beds. We don't have doctors to treat them. That after I had been with the Pediatric Healthcare Association, that they had been trying to talk to me about telehealthcare, and that was a way to help reach people. And I thought that was a terrible idea. I think that if you've got an issue, you should be able to see a doctor. But they knew I was going to be a problem if I was saying that. And so they made sure. So I went downriver and went and visited. And it doesn't make me happy, but there is a social worker there. And I did not realize, like I realize now, just the shortage of healthcare providers. We have to help people. That's one of the issues that we've got to address. So I'm already off script in case you can't tell. But I think we got to talk about these issues. We got to figure out how we incentivize people to go into healthcare so people can get the help that they need. But we also need to be willing to talk about it, period. We know that people are likely to confront their problems they have to face if there's a safe space to go to and they're not alone. So we got to improve the access to mental health services, but we also have got to do we got to invest in research. We don't know enough. And we need to understand it more. But the thing that is probably, for me, the number one issue is addressing the stigma. And there's still too much stigma. And I think it's an issue that simply cannot wait. We have, you know, if you're in high school, if you're in grade school, if you're at work, if you're elderly, an elderly might be what, you know, we don't understand there are so many, each age group's got different issues. I've spent a lot of time with kids now talking about suicide. For a variety of reasons. They've invited me to come because I'm pretty open, and people will feel guilty if somebody in their class has committed suicide. They don't understand it. Who can understand it? But at the young age, we need to help them recognize sometimes people just need somebody to talk to. Parents have got to not be afraid to have a child say, I'm anxious. I'm depressed. if a child's being bullied, they need to be able to tell their parents. And I say to kids, you know, it depends what age you are. At college, at Michigan, I tell them, if your roommate's depressed or one of your friends is depressed, help them. Help them go get some help. Tell them to talk to somebody. Tell a resident assistant on the floor. But if you're in high school and you see someone being bullied, we've got to encourage our young children to stand up to being bullied themselves, which is hard. But if you see someone being bullied, be the cool kid in the school that says it's not okay. Because we just don't realize how that is impacting people. Veterans are coming home. Veteran suicide is a real problem. And, you know, we have been making a real effort, or I have in the 12th District, to get veteran courts set up. They're trying to train police, law enforcement, to recognize post-traumatic stress in a veteran. And again, this is one of my real I have a lot of bugaboos when it comes to this issue. But I cannot tell you how many families, this happened to somebody in my neighborhood. Their son was not suicidal, he was homicidal. And he tried to go to both the Ann Arbor VA and the Detroit. He went to the Detroit VA first and then the Ann Arbor VA. And they don't have mental health providers. They didn't have a bed, and they turned him away. And the VA knows that we know we have a veterans problem. We have got to make sure that we have got psychiatrists and social workers at these veterans hospitals to help the veterans. But in the community, we can never do what we did to Vietnam veterans. They went to fight for us to protect this country and came home and were treated in the worst manner possible. And those Vietnam veterans are still suffering from depression and anxiety today. But they are. I mean, it's a problem. But now, when we see other veterans come home, we have to be there as a community. They're fighting for us. We can never I'm not going to get political today, but we need to worry about what it means to be American, about what our democracy is. And they go into the military to defend us, to defend what we believe in, and they come home and we're not there. It's simply not okay. And we got to take that stigma off. We got to rip that Band-Aid off and get people to understand what they've been through and welcome them home back to the community, have the resources available that they need, and assimilate them back into the community. Okay, so I'm totally off subject, I'm not off subject. I'm telling you how I feel, because that's what we've got to talk about. The inequity between mental health care and physical health care is vast. For physical problems, you go to the doctor, you get a checkup, everybody thinks it's okay, your insurance covers it. Hopefully you can get an appointment within a decent amount of time. But most people don't seek out a mental health professional when they need it because they can't afford it, they can't find it, and they're afraid of the stigma. The result is that too many people are only seeking help after a crisis has occurred, which, as we all know, is too late too often. And I'm sure you've been here, so you're hearing the figures. The scope of the problem is staggering. 1 in 5 adults, approximately 43.8 million Americans, experience some form of depression, anxiety, or a more serious disorder in a given year. Children and young people across the country are greatly impacted by mental health issues. Approximately 20% of youths aged 13 to 18 experience some kind of serious challenge, serious problem in a given year. And those numbers are worsening every year. You know, one person in America takes their life every 13 minutes. And in the world, it's every 40 seconds. I thank you all for talking about Kevin, who was 41, and I gave you that statistic before, that it's the 4th leading cause of death in that age group. It's the 2nd leading cause for young children 15 to 24. And we know that seniors, we're seeing a very serious increase in seniors. And you need to think about that. Why? They're lonely. There's nobody to care for them. They get sick. There's nobody to take them to the doctor. They can't afford care. They can't afford their medicine. I mean, what we also have to worry about is wraparound services for why this is happening so much. And we have to help people deal that there's no shame in acknowledging that you have the problem. You know, and I will tell you that Rich mentioned, or I can't, or Paul did, that they had seen me at Beaumont. Beaumont asked for my help because we have this real shortage of beds throughout the state. That is a real problem. So they are building a hospital in Dearborn, which is going to add more beds. And I said to them, consider me your total partner. I will talk to people in the community. I will go anywhere and talk about it in this state because we need to be building more beds. And we also have to figure out how we're going to get more people to be providers. We have to. You know, it's hard. There's some tough moments, but we've got to incentivize young people to go into that field when they're becoming doctors. Now, this can be controversial, but I say it, and I'm very blunt about this, that we can't shy away from the role guns play in high suicide risk. It's a very significant public health crisis. Nearly 2/3 of all the gun deaths in the U.S. are suicides. And the problem's getting worse. Over the past decade, suicide by firearms has increased 19%. Even more concerning is the rate of firearm suicide among children and teens, which has increased 82% over the last 10 years. And veterans have a firearm suicide rate 1.5 times higher than non-veteran adults. These statistics can't be ignored. So we've got to take action and talk about that, and we have to reduce those statistics. So one of the things that I am been pushing very strongly at the federal level, and I think we need here, is that when someone is a threat to themselves or others, family and law enforcement need tools to act when they see the warning signs before it escalates into something that it shouldn't. So I have introduced with Fred Upton, bipartisan at the federal level, and people are trying to get it done at the state level, red flag legislation, which, just for the record, for the record, I introduced Susan Brooks, who's a friend of mine from Indiana, another Republican. This bill was passed in Indiana when Mike Pence was governor. So I talked to, I've known him for a long time. I shouldn't call him Mike Pence. I should call him vice president. And I said, we should be able to get this done. I'll tell you something. When I was young, I kept my father from killing my mother. Those guns scared me to death. And when I called the police, they didn't even come. I'm not that old, but I am seasoned. And it used to be that people wouldn't even respond to those kind of cases. And they didn't when I called the police and was sure we were going to die that night. But law enforcement didn't have any tools to take those guns away from my father. And my mother's response was to go out and buy a gun. You want to know what that does to kids in a house? You want to know what that does to your anxiety level? If someone's a threat, we need to be able to protect them and the community or the school or whatever it is. They get their due process. They can go to court and prove that they're okay. But give law enforcement a tool to use to keep somebody from harming themselves or harming someone else in the community, period. So it saves lives. I want to say that. And I used to sit there. I didn't talk about this for a long time. I have to say to you that when I first married John Dingell, I was scared to death somebody was going to find out about this side of me. That they would, but it's true. Think about it. Some of you are young, some of you are more seasoned, none of us are old. But you didn't talk about any of this. It was, you just, I don't want anyone to know what. Well, you know what? More of us need to talk about it so nobody has that stigma. And it's not a stigma to say your child is in trouble. It is not a stigma to call your local law enforcement who wants to help you and work with you, or to have someone at the school who's identified someone's in danger of hurting somebody that's in that school or that church or themselves or that family and say they need help. We have to remove the stigma of people being afraid of what people are going to say or what people are going to think and be able to get the help that people need. I don't want to take anybody's guns away, but I want to keep people alive. Another thing Congress has done is to create the 3-digit number for the suicide prevention hotline. I'm pleased to say it's a bill which I helped champion, was passed by the House and Senate. Yes, bills can pass. And it was signed by President Trump. And the FCC is working to implement it quickly so you can connect with the hotline just as easily as you can do 911. See, there's hope. If you can get the House and Senate to act on something and Donald Trump to sign it, there is hope. When people seek help and they get connected, they get the help they need, we can save lives. So I know you don't want to go too long, you've got to eat lunch. I just want to say how important this is, that you're here, you came out in the bad weather, that you're working with each other. Because we got to work together. We have got to remove the stigma. Channel 56 is going to start talking about this more. This is, if someone's depressed, if someone doesn't want to go on living, it's more serious than a cold. But it's like cancer. It's life-threatening. And we can prevent people from harming themselves. We've got to talk about it more. We got to be there for each other. You know, I hope that everybody in this room hasn't had to reflect on losing someone that they loved. But you've worked with somebody. You wouldn't be here if you didn't care somehow, some way. We got to be the loud voices. You know, when people stick together, united you stand, divided you fall. Well, let's be united on talking about this as an issue in our communities, that we got to put the resources in, that insurance companies can't not address treating these issues because, they cost too much money. Well, you know what? A little preventative medicine will help save dollars down the road. And think of what it can save a community from the hurt or tearing a family apart or a life lost and the potential that they had. We can't put a figure on a life. Mental health is real, and it's as real as any physical problem, and we need to demand equity. We need to demand beds, we need to demand providers, and we've got to give them the resources that they need. So we are addressing these issues, and every one of these statistics, which are awful, we reduce and start to get rid of. So thank you for being here, thank you for caring, and let's work together.